Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about skin assessments. Skin is the largest organ of the body and has many areas involved in its assessment. In this video, I'll be focusing on the general assessments of the skin and as well as how to implement measures to maintain skin integrity and prevent skin breakdown. Diseases of the skin may be local or they may be caused by underlying systemic problems. In order to perform a complete and accurate assessments, the nurse needs to collect data about current symptoms, the patient's past and family history, and health and lifestyle practices. When looking at the current symptoms, ask the patients about the skin problems such as rashes, dryness, oiliness, bruising, open sores, itchiness, etc. Any birthmarks or moles, or any inability to feel pain, pressure, touch, or temperature. Any numbness or tingling or trouble controlling body odor. Any body piercing or tattoos. When the patient shares symptoms, use the mnemonic cold spa as a guideline for collecting the needed information about each symptoms. Character. Describe the signs and symptoms. Onset. When did it begin? Locations. Where is it? Durations. How long does it last? Does it recur? Severity. How bad is it does bother you? Pattern. What makes it better or worse? And associated factors or how it affects the patients. What other symptoms occur with it and how does it affect you? When assessing the past health history, ask the patient to describe any previous skin problems in any treatment or surgery that was done. Any allergic skin reactions or any recent fever, nausea or vomiting, or respiratory problems. For female patients, are you pregnant? Are menstrual cycles regular? And any history of smoking or drinking alcohol. Any history of anxiety, depressions, or other psychiatric problems. When looking at the family history, ask the patient, has anyone in your family had recent illness, allergy, rash, or other skin problems? Anyone in your family had skin cancers? Any family history of keloid scars? Some skin conditions tend to be hereditary or conditions, so it's beneficial to know what patient has been exposed to and what runs in their family. Lifestyles and health practices play a big role in assessment of skin. Ask the patient, do you sunbathe or tan? Are you regularly exposed to chemicals that may harm the skin such as paint, bleach, or cleaning products, or petroleums, or insect repellents, and etc.? Do you spend a long time sitting or lying in one position? What do you use daily in your skin, such as soaps, lotions, oils, cosmetics, or type of razor? What do you eat and drink in a typical day, or do skin problems limit any of your normal activities or prevent you from enjoying relationships? Describe the stress in your life. Do you perform a monthly skin self-examinations? The physical assessment of the skin involves inspections and palpations and may reveal local or systemic problems in the patient. Inspections involve looking at the following: general skin color. Abnormal findings would include pallor, cyanosis or jaundice, color variations, look for rashes or erythema, skin integrity, carefully check pressures points, areas of lesions, note the color, shape, and the size. When palpating the skin, it is important to note textures. It should be smooth and even. Fitness and very thin skin may indicate steroid therapy or arterial insufficiency. Moisture. Increased moisture is felt with fever. In hyperthyroidism, decreased moisture occurs with the dehydrations or hypothyroidism. Temperature. Cool skin may accompany arterial disease. Cold skin is felt in the shock or hypotensions. And very warm skin is felt fever or hyperthyroidism. Turgor refers to the skin elasticity and should pinch easily and then immediately returns to its original position. Edema. The skin should rebound and not remain intended when pressure is released. A very common skin problem you will encounter as a nurse is the pressure ulcer, also known as a bed sore. Pressure ulcers are localized injuries to the skin and underlying tissues that nearly always develop in areas where the bones are right under the skin. This includes the heels, ankles, tailbones, the hips, elbows, shoulder blades, ears, and back of the head. If body weight is continually putting pressure in the place where a person is sitting or lying for a long time, not enough blood can get through to provide oxygen and nutrient. The skin becomes thinner. Over time, it gradually dies, creating an open wound. Risk factors for skin breakdowns leading to pressure ulcers include poor circulations, poor hygienes, including positioning, changes, infections, dermatitis, or traumatic wounds. Pressure ulcers can lead to sepsis and even death, and they're much easier to prevent than to treat. As a nurse, it is extremely important to assess the patient's skin adequately and carry out preventive measures. For initial assessment of the potential to develop pressure ulcers, use the braided scale. This assessment tool measures the sensory perceptions or the ability to respond meaningfully to pressure-related discomfort. Moisture, the degree to which skin is exposed to moisture, activity, the degree of physical activity. Mobility, the ability to change and control the body position. Nutrition, the usual food intake pattern and the frictions and the shear. The nurse's responsibility for assessing and preventing pressure ulcers includes the following. Inspect the skin at least daily or more often if high risk, using a risk assessment tool such as the braided scale. Mate with mild soap and warm water, limiting frictions. Use incontinent skin cleansing methods as needed. Avoid shear and frictions by using carefully positioning, turning, and transferring techniques. If the patient is better chair-bound, reposition, or teach self-repositioning every 15 minutes for a chair or every 2 hours for a bed. Use a chair cushions or pressure mattress, position pillows or wedges to maintain body alignment and avoid bony prominence contact with surface. Use lifting devices, if available, to reduce shear for the bed bound and avoid elevating to the head of the bed except for the short periods. If a patient has to sit or lie down without moving for a long time, even if just for a few days, it is important to reduce pressure on the parts of the body that are most at risk. And remember to document everything you do, because in the medical legal world, if you didn't document it, you didn't do it.